How are we doing, folks? Today we're going to go over knee mechanics. So a lot of people, when they start to get a little bit more active, they start developing a little bit of knee pain. Now you can have knee pain on the inside of your knee, the front of your knee, the back of your knee, outside of your knee. So what I want to talk about first is basically the mechanics. What is your knee? Your knee is two bones that sit on top of each other like this. It has the ability to bend forward, bend backward, twist in and out. Your patella sits on the front of it, which is your kneecap, and that joins the two of them together. Now, in order to produce force in the knee, the patella has to push against the femur. The larger the patella, the more force it can produce. The larger the muscle, the more force it can produce. So what we want to look at is how that knee is working, what muscles we can influence to increase the strength in it, and what other areas can we target to try and create the stability. Because if you have two bones sitting on top of each other like that, the movement can bend either side, forward or backwards, so it can be quite loose. Now there's very, very strong structures like your ACL and your PCL, they're your cruciates that stop the knee from sliding forward or backwards. Then you have these two ligaments on either side that prevent it from turning in and out. So all in all, it's a very, very robust structure. The idea of the knee is to be able to transmit force through your foot up into your hips, but also be able to produce force when you're jumping, running, sprinting, landing. What you have to understand is that a lot of people, if their quads aren't kicking in as well as they should, then that knee, the forces going through the knee are not going to be absorbed correctly. So think about your muscles. What they're designed to do is distribute the load, and so is the joint designed to distribute the load. And then again, if those muscles are weak, then somewhere in that joint is going to take more of the force. So our idea is when we have somebody coming in with knee pain is we want to kind of go, right, what's going on with the knee? How can we settle this down quite quickly? And how can we strengthen this up to prevent it happening again? Sometimes we might need to target the ankle because the ankle will be quite weak. The ankle needs to absorb the force, then the knee absorbs the force, then the hip absorbs the force. So what we want to do is to be able to, if we can get the ankle to absorb more force, then the knee obviously takes less. If you get the knee to absorb more force and the ankle to absorb more force, then the hip takes less pressure. So ultimately, if you have in front of the knee, you have your quads up at the top, you have your hamstrings at the back. The quads help the lower shank kind of pull forward, and the hamstrings help the lower shank pull backwards. So again, you need to have stability forwards and backwards on that side. 9 times out of 10 when we have females coming in, they have pain, it's going to be a glute or a hamstring problem, or it's going to be a hip problem. So what we want to be able to do is to be able to stabilize the outside of the hips, make sure the ankle is nice and strong, and create a little bit more force through the hamstrings, because inherently females are quad dominant. When your knee starts to flare up, there's a couple of things that you can do. Number one, reduce down your activity. Don't be walking mad distances because it's going to irritate it. Never in the history of knee pain has somebody kind of going, oh, I'll just walk through it and it'll be grand. That never fucking happens. So you want to reduce down your activity. You want to get ice. Ice in a sandwich bag with water increases the surface area that ice is on the skin, and it also the water keeps that ice down. Now all we want to do is get the skin temperature down to about 2 or 3 degrees, and that's going to penetrate a little bit deeper and reduce down all the inflammatory markers that are in the knee. You can take some anti-inflammatories like Nurofen. Paracetamol probably will take a little bit of the pain out, but Nurofen is a little bit easier. If you have stomach problems, don't take the Nurofen, consult your doctor or talk to the pharmacist. If you want to keep your activity up and your knee is getting a little bit too sore with the walking or the hiking or the running, get on your bike and start cycling, and that'll get that quad to kick in a little bit better. What we generally do is we would keep the saddle up quite high, so the knee revolution is quite low, and then as you start to get better, get that knee down a little bit lower, and that's going to target more the center of the quads or your center of your rec fem muscles. And then the last thing is at least stop wearing flip-flops. We're coming into summer. Everybody wants to kind of have their toes out, but unfortunately, if that's going to affect your knee, don't wear the flat shoes if your knee is pissed off. Try and wear something a little bit more supportive until that knee settles down, then gradually ease back into it. So we have mechanics, we have your quads kicking in, we have your hamstrings kicking in. Again, don't forget about your calf. Your calf actually sits at the back of the knee and crosses over the knee joint, so that's a very, very powerful knee extensor. So again, that's going to control the joint as well. And we want to have targeted all of those muscles as much as we can. Ankle stability is a big one. Again, if you have a previous ankle injury, that ankle is going to be a little bit wobblier, and you're going to feel that if you kind of stand on one leg, you'll feel your ankle rocking in a little bit more. Again, if that ankle rocks in, it's going to direct the force not through the optimal way through the knee, so the knee is going to get irritated on that side of it. Hip stability. If you're sitting down at your desk and you're crossing your legs all day, that's going to stretch out the glutes. The glutes are going to become a little bit weaker. Again, that knee bends forward and backwards, in and out, so it'll create stability from the ankle down here or from the hip up in that position. So targeting those points are going to help it too. Pain in the front of the knee is normally related to your patella tendon, or sorry, not your patella tendon, your actual patella. If it's deep inside the kneecap and it feels like it's kind of rubbing underneath it, rubbing, clicking is absolutely fine. But if you're starting to have pain with that rubbing and clicking, then you probably want to pay attention to it. Normal clicking, it's like cracking your knuckles. Don't worry about it unless it's painful. Ligament injuries only occur in the presence of of a trauma. So unless you've kind of fell over and twisted your knee and kind of go, oh, fuck, I've done something here, generally ligaments aren't affected. But as you get older, what can happen is you can have a gradual wear down of the cartilage that's within the knee. And they're like shock absorbers that are in on the right hand, and there's two of them on the medial and lateral side. And sometimes, if you don't have enough muscle control in your knee, though that knee is going to, mechanics of your knee is going to change slightly, and it's going to wear that down just a little bit faster than normal. So it's always good to have nice, good, strong legs in that side of it. That's the basics around knees. It's very, very basic, but just to manage the flare-ups, make sure you're using reduced activity, ice, anti-inflammatories, cycle if you need to, if you want to keep up your activity, but make sure that's not pissing off the knee, and then wear supportive shoes. Again, we're open for any questions that you want. We're happy to discuss any kind of issues that you have across the phone, so don't be afraid to give us a shout. And yes, I've moved through this very, very quickly, so you might need to watch back over this again. But that's the basics of knee mechanics. What we do here in the clinic is we generally will take you through a rehab program where it's going to target the quads and the ankle complex, where we're able to get the two of them to work together, and then we can get your hamstrings and your glutes to work together, and that's generally stabilizes all the knee. Now we'll get you back to activity, but again, if you're going to be playing soccer, Gaelic football, tennis 5 days a week, that's a different story. So you have to be realistic about what you're able to do. Again, if you have that knee pain that's going on for more than a couple of weeks, it's going to take a couple of weeks to settle it down. Don't be expecting to come in and just have it sorted in 1 or 2 sessions, because we have to contend with, number one, reducing the pain, number two, correcting the imbalance that was there previously. But we have a lot of the equipment there to that will laser target some of the strength qualities that you have. So there's no guessing involved. We have all the equipment here to make sure that we're running by the data, and we're running by the sports science, and we're running off the information that each one of these pieces of equipment has given us. But yeah, very, very quickly, knees 101. Hope that helps. Any questions, give me a shout.